Hi CTSNet, my name is Rajika. I'm a general surgery resident at Montefiore Medical Center.
Hi, I'm Tanisha Raja and I'm here with CTSNet at the inaugural WTS annual meeting in San Diego.
This is our inaugural meeting and we are celebrating the presidency of Dr. Daniela Molina, and as the Vice President, I'm really excited that everyone's here to join us.
We're about to kick things off for our speed mentorship event. We're very excited because normally we actually just have webinars and do this all over Zoom. So this is our first in-person speed mentorship event. So we really can harbor great relationships with multiple different people and multiple different subjects even as well.
I'm representing the team of airway surgery from my hospital, Unicamp, and it's a pleasure to be here with all these inspiring thoracic surgeons.
I think the energy of this meeting is infectious and contagious. Just coming to see you today, it took me 20 minutes to get down the hallway because everybody was so excited to see each other, and seeing all of the residents and fellows and medical students who are so talented and excited to be here has been really huge and really satisfying.
There are a number of important events taking place, a number of lectures, didactics, for women in CT surgery to help us understand how we can develop our careers, how we can ascend to leadership positions, how we can be most successful in the climate where we practice. And the other key component of our conference is our scientific meeting. And so we have a number of outstanding abstracts that are going to be presented in poster format, as well as the top presentations that are going to be presented orally. And we have, of course, a lot of science as it relates to diseases of the heart and lungs, but we also have a number of phenomenal presentations that relate to workforce disparities. And these are things that women in CT surgery face every single day. And I think we haven't necessarily had a format to share the science and think about how we can move forward in all of these areas.
We are looking at the gender disparities and scholarly interactions at cardiothoracic conference meetings. What we found was that women are more likely to be interrupted and more likely to be addressed by an inappropriate title at these national meetings. So we see that there are some disparities in the scholarly interactions.
So I think the point that is the first annual Women Thoracic Society, and the point that I have already participated of the ESTS, WTS, Women Thoracic Society, with a lot of fellowships across all of the world. So I think this is the most important thing here today, to get us together again and represent this society. It's really important for us.
We had the opportunity to speak with a couple of members of the WTS, a cardiac surgeon, a thoracic surgeon, and a couple of members from the Korn Ferry search firm that represented what the role is for a search firm in looking for a job and how they can help with CV help or with just practicing interviews, and also actually getting people connected to jobs, what the process is like in looking for a job, what are some red flags to look for, what are some of the challenges that you may face, and then once you get into that first job, what are the things to think about and how to establish yourself, how to make a niche for yourself to find success in those first few years of practice.
My project was basically looking at patients that underwent valve sparing root replacements in the setting of having severe AI. We were trying to identify which patients that had severe AI would have recovery of essentially their LV function and size and time over time. And so we were just looking at what are the characteristics that can distinguish patients that will have LV recovery.
This is the first time ever that trainees and people who have already done this, people who have already figured this out, are getting together in the same place to talk about things just like that. How do I advance my career and manage my family? These women have all done it. It's amazing.
Share something like experience professionally, we can support ourselves too. So this is the message. Yeah, it's the most important message that we can do here, something like this.
I think WTS is kind of taking their place, their seat at the table, and saying we have not only enough numbers, but enough experience, enough work that we're doing to stand on our own and say we need our own independent meeting where we can come together, share ideas, invite our male allies to come join us and see the work that we're doing. And young women around the world who are interested in CT surgery and may not know much about it, may not have people at their institutions that that are modeling life as a CT surgeon can come and see it and get connected and network and hopefully continue to grow the field.
I'm just really excited for the opportunity to see all of these women shine, to see our mentors and sponsors be here and be present. We've got presenters who are men and who are women. We've got discussants who are men and who are women, and we're discussing so many things that are relevant to women and therefore they're important to our specialty. We recognize in other aspects of the working world that the more diverse of a group that we have, the better we're able to do a job. And in medicine, it's clearly demonstrated that we can provide better care. So honestly, it's all one goal, to provide the best care that we can for patients with diseases of the chest. And we can do so much better when we basically have a field that encompasses a working environment where everyone can succeed, everyone can ascend, and the strongest individuals can give in the best way that they know how.
The best moment so far has been, one, seeing all of these women who are accomplishing these things and have all of these positions on boards and committees, and so you're thinking, oh my gosh, I can also do all of these things if I just kind of keep working hard on the things that I've been doing. It's also really nice for the collegiality aspect. The last thing that's really been really monumental has just been the ability to network and meet people, and even if it's just asking them one question about a particular subject, it's just nice to be able to talk to somebody freely, and maybe at the end of that conversation about your research, you can ask, how are your kids? Or what is it like to have children in this profession? And for that question to not be judged, but to just be able to have a genuine discussion about it.